This is a video on the classification of joints. So joints can be classified based on structure, mobility, or range of motion. The joints based on structure are the synovial joints, fibrous, and cartilaginous joints. All synovial joints have an articular capsule with a fibrous layer and a synovial layer, and the articular surfaces are covered in hyaline or articular cartilage. There are 6 types of synovial joint: hinge, pivot, ball and socket, condyloid, saddle, and plane. The hinge joint only allows flexion and extension, meaning that it has bad mobility but good stability. For example, the humeroradial and humeroulnar joints, or the elbow joint, the knee joint, and the talocrural joint, which allows dorsiflexion and plantar flexion of the ankle. The pivot joint only allows for rotation, for example, supination and pronation of the forearm, and these can happen at the radioulnar joints and the atlantoaxial joints between C1 and C2. The ball and socket joint allows for movement on all axes, so that's flexion, extension, abduction, adduction, rotation, and circumduction. And this can take place at the glenohumeral joint, or the shoulder joint, and the acetabular-femoral joint, or the hip joints. And unlike the hinge joint, this has higher mobility, but it has less stability. The condyloid joint is similar to the ball and socket, but the oval shape prevents the rotation. So it can still flex, extend, abduct, adduct, as well as radial deviation and ulnar deviation. And this can take place at the radiocarpal joints between the radius and the scaphoid and lunate of the carpal bones, the metacarpophalangeal joints, the metatarsophalangeal joints, and the atlanto-occipital joints. The saddle joint is where a concave area crosses the convex area of 2 different bones, and this allows for flexion, extension, abduction, adduction, and a slight rotation. And for example, this is at the carpometacarpal joint of the thumb, where the trapezium, a carpal bone, articulates with the first metacarpal. And the concave area is the area that curves inwards, and the convex area is the area that sticks outwards to fit into the concave area. The plane joint is a gliding joint, and it allows for gliding movements and rotation. For example, at the subtalar joint between the talus and the calcaneus, at the acromioclavicular joints between the clavicle and the acromion of the scapula, and also between the intercarpal and intertarsal joints, as well as the facet joints between vertebrae. Fibrous joints are also classified on structure, and there's 3 different types. There's the sutures, gomphoses, and syndesmoses. The sutures are where the edges of the bones fit together and are bound by a connective tissue called the periosteum, and this is only found within the bones of the skull. The gomphoses is where the teeth fit into the socket, and that's the only gomphoses in the body. And the syndesmoses is formed by ligaments and a membrane that holds the 2 bones in place, and it also helps to stabilize the bones. For example, the interosseous membrane between the tibia and fibula, and the interosseous membrane between the radius and ulna. The cartilaginous joints are the last type of joint based on structure, and there's the synchondroses and the symphysis or symphyses. The synchondroses is classified as the primary cartilaginous joint, and that allows no movement, so it's called a synarthrosis. The bones are connected by hyaline cartilage, for example, the first sternocostal joint, which is between the sternum and the first rib. The symphysis is the secondary cartilaginous joint, and that's slightly movable. And instead of hyaline cartilage, like in the synchondroses, the symphysis has bones connected by fibrocartilage, for example, the pubic symphysis and the intervertebral discs to allow the slight movement of the vertebrae. There's 3 types of joint classification based on mobility. So the diaphoresis are the freely mobile joints. For example, the synovial hinge joint, and every synovial joint is a diaphoresis. So even a ball and socket, or a saddle joint, or a pivot joint, or any synovial joint is classified as a freely mobile joint. The amphiarthrosis is a slightly mobile joint. For example, the symphysis, so the pubic symphysis or the intervertebral discs. And also the syndesmosis of the fibrous joints is also classified as an amphiarthrosis because the interosseous membrane is slightly mobile. The synarthrosis is the immobile joints. So, for example, the synchondroses or the primary cartilaginous joint, which could be the coronal suture or the fair sternocostal joint, as you can't move these at all. There's 3 joint types based on range of motion. There's the uniaxial, biaxial, and polyaxial joints. The uniaxial joint moves along one axis, for example, the hinge, pivot, or plane joints. And this allows either flexion and extension, abduction and adduction, or some form of rotational movement. Biaxial moves along 2 axes. So, for example, the condyloid and the saddle joint. So they can do flexion and extension as well as rotation or abduction and adduction. And the polyaxial moves along all 3 axes. So that would be the ball and socket joint. And that allows all types of movement.